Vanishing lung syndrome. Definition is a radiological syndrome in which the lungs appear to be disappearing on X-ray. The syndrome is characterized by a progressive decrease in the radiography opacity of the lung.
HD and in full screen by adjusting the settings on the player so you can appreciate the fine details of the images. Once again, our normal chest X-ray is in front of us, and compare it with the X-ray that is visible on your left hand side. Now if you have seen a few normal chest X-rays, you'll realize very quickly that there is definitely something wrong with the patient on your left hand side. The mediastinum is white in this area on this patient. There is a mass effect in aortopulmonary window, so the aortopulmonary window on this patient is this, which is normal, but there is a mass effect here, and there is a mass effect, there is a widening here on the left hand side. So first thing that comes to mind after seeing the mediastinal widening in this area would be enlarged lymph nodes. You can see abnormal opacities in both lungs here as well, and there is an abnormal lucency here and in this area, and most probably in this area as well.
Causes include the accelerated progression of emphysema destroying the lung or the rapid cystic destruction of the lung by infection. Radiography criteria. The radiography criteria for vanishing lung syndrome were proposed in 1987, and they include Gian bullet in one or both upper lobes, occupating at least one thereof the hemithorax and compressing surrounding parenchyma.
Today we continue our theme of atelectasis. This is a patient who comes in with asthma, an exacerbation, and thick sputum. His afebrile. We get this chest X-ray and we see that it's remarkably abnormal. First we can appreciate that there's a triangular opacity in...
no, ¿verdad?
Lung volume reduction surgery is considered for select patients with vanishing lung syndrome after assessment of exercise capacity, pulmonary function testing, and smoking cessation.
We had trouble with it. It isn't an easy case. We can see here that 3 cases of pulmonary embolus and their manifestations. This is a patient that comes in with pleuritic chest pain. Can you tell which side it's on? Well, we had trouble with it. It isn't an easy case. We can see here that the lungs, we want to compare them side to side, and we look for any asymmetry of opacity. And we can see that there's an asymmetric opacity at the left base. And as it turns out, that's exactly where the patient's chest pain was located.